Herpes zoster virus involving S1 dermatome. What is herpes zoster? Herpes zoster or shingles is a painful blistering rash caused by reactivation of the herpes varicella zoster virus. The primary infection presents as chickenpox, usually during childhood. Like herpes simplex, the virus persists in the enterohorn cells before it is reactivated. One of the most clinical relevant properties of herpes virus is their ability to establish a latent infection. This means that the virus can lay dormant in the body, becoming reactivated under certain conditions and manifest symptoms long after the initial infection. The most prominent factor, especially in regard to shingles outbreaks among older adults, is general age-related decline in immune function.
Herpes zoster. Herpes zoster is an infection of the nerves supplying certain areas of the skin, caused by varicella zoster virus, which also causes chickenpox. After an episode of chickenpox, the virus can remain dormant in nerve cells for several years and re-emerge as shingles. Symptoms include itching, tingling, pain, and rash that turns into blisters, which gradually crust over, leaving scars, usually on one side of the body.
Signs and symptoms: weak patches, feels, blister, rash, itching, headache, fever, chills, burning pain, paresthesia. Next video.
Shingles is a skin rash caused by varicella zoster virus, the same virus that causes chickenpox. It is a painful skin rash, usually with vesicles, and occurs in a cluster or band localized to a small area of the body. Shingles occurs when the virus that causes chickenpox becomes reactivated. After one recovers from chickenpox, the causative virus becomes dormant in the nerve roots. In some people, it remains dormant forever, while in others, the virus gets activated if the person becomes stressed or has a weaker immune system. In few cases, certain immunosuppressive drugs may also cause activation of the virus. The initial symptoms one may feel are itching, tingling, or pain in the area. That's where the rash will appear after a few days. The rash will turn into a cluster of vesicles. Then these vesicles break into small sores which will dry and form crusts. These crusts will fall off by themselves in 2 to 3 weeks. Other symptoms that you may experience include abdominal pain, fever and chills, general ill feeling, genital sores, headache, joint pain, and swollen lymph nodes. During the shingles attack, especially when skin blisters are present, the virus can be transmitted to people who have never had a varicella virus. In general, these are mainly children. Varicella infections can be harmful to newborn babies. Therefore, people with active shingles need to avoid contact with newborn babies. In elderly, shingles can occur when they come in contact with children who have chickenpox infection. Shingles usually gets healed by itself without any treatment. Treatment is recommended when shingles is present on the face or when one has low immunity. Treatment of shingles includes prescription of an antiviral, anti-inflammatory, and antihistamine medicines. Antiviral drugs such as acyclovir may be prescribed to fight against the virus. It is best to start taking antiviral drugs before the vesicles appear. Anti-inflammatory medicines such as prednisone are given to decrease swelling and pain. Also, painkillers and cool wet compresses can help reduce pain. To speed up drying of the vesicles, daily application of a zinc-containing ointment can be used. Shingles can be prevented by avoiding contact with people having shingles or chickenpox, and getting vaccinated with the herpes zoster vaccine. For any further information or advice, you can best consult your family doctor.
Another complication. Dermatome. A dermatome is the area of sensory nerve near the skin. That area supplied by a specific spinal nerve root. Involving S1 dermatome. Herpes zoster is unusual in persons younger than 10 years of age, and when it does occur in this age group, the lesions have a predilection for dermatomes supplied by the cervical and sacral nerve.